Emphysema, it is a chronic inflammatory destruction of the walls of the air sacs, that is the alveoli, which are meant for gaseous transfusion, that is absorption of the fresh oxygen from the walls of the alveoli into the capillaries found in the walls of the air sacs into the blood, and the exit of the carbon dioxide from blood through the airways outside. So in this disease, the function of the alveoli are disturbed. According to the grading of the disease, the part of the diseased alveoli is reduced, and the remaining functional portion, they perform the healthy function of the lungs. The various symptoms produced in this disease is productive cough, chest pain, dyspnea, shortness of breath, breathlessness, irritability, palpitation, edema of feet, legs, around the ankles, cyanosis, pleural effusion, and the compression of the lungs due to the pleural fluid that reduce the vital capacity of the lung. There is pulmonary hypertension. So these are the various main symptoms produced in emphysema. Symptoms and signs. Now the signs is diagnostic procedure which are performed, the various imaging tests, series of X-rays of the lungs that locate the and the extent of the damaged area of the lungs or the functional area of the alveoli. In addition, to study the detailed damage produced by this disease, we can perform the CT scans. Then we have to perform the spirometry. It is a device through this forced expiration and inspiration volume is estimated along with the timing. This device helps to detect the function of the lung for gaseous transfusion. The classification or the stages of the emphysema is first degree when the 80% alveoli are functional, second stage when 50% are functional, third stage when 30% alveoli or the air sac area is functional, and final is the fourth one, which is critical one, I mean the severe one, that is the less than 30% they are functional. So this is divided according to the damage to the alveolar system, because this alveoli, they are responsible for the provision of the oxygen supply to all the organs of the body. Now, in addition to this, there are complications of the emphysema, as it is a chronic inflammatory damaging disease producing the vital portion of the lung, which is meant for provision of the oxygen and filtration of the blood. So when it is damaged according to the ratio, that is according to the severity of the disease, so it also produces the other critical diseases like asthma, pleurisy, tuberculosis, and the cancer. So these are the various chronic diseases of the lungs that may be produced by these diseases. And it is also to be considered that it is a disease of the group of COPDs. It is mostly associated with the chronic bronchitis. That is the inflammation of the bronchi or the airways, due to which there is narrowing of the airways, so there is obstruction in the passage of the air during the inspiration and expiration. So that produces painful cough, which is productive, excessive production of mucus, which block the air passage. So this is associated with emphysema, and that produces a very severe and critical situation that disturbs the breathing exercise or the function of the patient. So the patient feel breathlessness, dyspnea, shortness of breath, irritability. So these are produced by the both two chronic diseases, that is the chronic bronchitis along with the emphysema. There is also damage or the inflammation of the nerving of the airway along with the alveoli, which are the air bags, air sacs, which are meant for the gaseous transfusion, that is all damaged. So the oxygen supply in the blood is lowered. This is called as hypoxemia. And the carbon dioxide level in the blood is, that is hypercapnia, is elevated. That indicates that there is a pathology or the function of the alveoli is damaged, and that is not a physiological or the up to the normal mark.